Hi, good morning, Vincent. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 17th of February 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Vincent Greenfield.
And, what is your candidate number?
My candidate number is 238822109.
All right. Are you taking this test as a nurse?
Yes, correct.
Now, can I see your ID?
Sure. Here it is.
Thank you. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has got a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living, and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership, and would be interested in any committees that I could participate in and learn. I have lots of ideas, and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Hello, good morning. My name is Vincent Greenfield, one of the registered nurses working in the Hospital Outpatient Department. For verification, can you tell me your full name and age, please?
Good morning, nurse. My full name is Mihiraa, and I am 35 years old.
Mihiraa, can you confirm the reason for your appointment?
I am here to attend the preoperative assessment, because I have been scheduled for a nasal polypectomy in 2 weeks.
Thank you for your confirmation, Mihiraa. Before we step into it in detail, do you have any specific concerns?
Well, nurse, I am a bit nervous about the procedure.
Your nervousness is quite natural. Don't worry, today, we will discuss in detail the procedure, preparation for the procedure, what you can expect after the procedure, and about the recovery. Thereby, you will get a very good understanding of the procedure, and can do your preparations accordingly. How does that sound?
Yes, that sounds great.
To begin with, let me outline the benefits of the nasal polypectomy. The aim of the operation is to unblock the nose and allow nasal breathing. You may get an immediate improvement, and further improvement may occur over the following few weeks.
That outcome makes me decide to have the surgery.
Definitely, Mihiraa, you will feel better. Talking about the polypectomy, the actual surgery may take about 30 minutes or more, depending on the size and location of your polyps. The surgery is performed with the aid of an endoscope, a camera inserted through your nostril. There will be no cuts or incisions. The surgeon uses tiny instruments to remove your polyps and other substances that block the flow of fluids from your sinuses.
Oh, I see.
And this endoscopic surgery is usually performed as an outpatient procedure. That is, an overnight stay is not normally necessary, but it is advisable to be prepared to stay the first night.
Sure, nurse. And do I need to prepare for the procedure?
Yes, I appreciate your awareness. Since the operation is usually carried out under a general anesthetic, you have to stop taking food and drink at least 6 hours before the procedure. You can take clear fluids until 2 hours before the procedure.
Okay, I will do that.
Post-procedure, occasionally, the surgeon will insert bleeding packs in your nose to stop bleeding. Nasal packing after endoscopic nasal surgery is a traditional effective method to control bleeding and prevent adhesion formation.
Okay, that's fine. Will it bleed heavily?
Not usually, Mihiraa. But, if it happens, you must stay in the hospital overnight. The packs are usually removed the next morning, after which, you may be fit for discharge.
What about bleeding after discharge?
I understand your concerns. There are some areas you have to be careful about. To lessen bleeding, you have to avoid these things in the first few days after your operation: blowing your nose, lifting anything heavy, or bending over so far that your head goes below your waist.
Okay, nurse. I will avoid these things.
Some bleeding from your nose is expected for a few days after the operation. But contact the hospital if you bleed a lot.
Okay. What about the medications after the surgery?
Yes, Mihiraa, now I will explain the post-operative medications. You will be given painkillers such as paracetamol, which are usually strong enough for the condition. Also, it is recommended to use a saltwater rinse, or some nasal drops, to promote healing after surgery. Additionally, after surgery, you will likely use a corticosteroid nasal spray to help prevent the recurrence of nasal polyps.
From your words, I suspect it may reoccur.
What you suspect is true. Following surgery, if not treated correctly, nasal polyps will likely return.
Oh, what should I do to avoid it?
Don't worry, Mihiraa, be relaxed. The following strategies are used to prevent nasal polyps from returning. Continue using a corticosteroid spray, which will help to reduce inflammation following surgery.
Okay, I will.
Apart from that, use a humidifier, especially during winter and in arid climates, to help moisten your nasal passages. This improves the flow of mucus in your sinuses, preventing blockage and inflammation that can lead to nasal polyps returning.
All right. Is there anything else I need to take care of?
Yes, it is advised to avoid nasal irritants, such as dust, debris, smoking, and common allergens that can cause inflammation in the nasal passages and sinuses. Also, kindly avoid known nasal irritants as best as you can.
Okay, nurse. I will take care of it.
That's great, Mihiraa. You'll probably go home the same day, though you'll need someone to drive you, because you are not allowed to drive for the first 24 hours. May I know if there's anyone to accompany you after the procedure?
Yes, my brother will be coming to pick me up after the procedure.
That's perfect. Mihiraa, is there anything else I need to address?
No, nurse. It's fine.
All right. Thank you for listening to me. Always, feel free to contact us for further queries.
Sure, thank you, nurse. That's the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.